Yes.
Hi, so I'm Justin Higgins, and today I'm going to be presenting about osteoporosis. And what is osteoporosis? It's a bone disease that occurs when your body produces too little bone, or when your body loses too much bone density, or bone at all. And it's you may see this when in older people they'll be hunched over. That's when because their bones are really low dense. And serious injury can happen since from sneezing or small bumps. And if you actually look at the word itself, osteoporosis means porous bones. So if you look under a microscope and cut it open and everything, under a microscope, a healthy individual's bone, it will look like a honeycomb or like a chain link fence or something. So there'll be a bunch of gaps in between it. But if you look at an individual with with osteoporosis, they'll have larger spaces and larger holes in between the gaps, which is the result of the lower bone density. And you guys can see that's what the looks like. Gaps in between the bones and stuff. But that's normal. So what is a healthy bone versus osteoporotic bone? Well, there's different types. There's regular osteoporosis, and that happens in adults. And then there's osteoporosis in children, which can be further broken down into secondary and idiopathic osteoporosis. And this is a better picture. So this is a normal bone. How you see kind of like honeycomb sort of. There's small holes, but if you look at the osteoporotic bone, there's looks very brittle, and you can break it easier. Just large spaces to begin with. So, like I said a second ago, secondary osteoporosis is a type of juvenile osteoporosis that happens in children, and that means that there's an actual reason behind why this kid has osteoporosis, and there's a cause for it, for the condition. And if you look at other conditions, there's some other major ones like diabetes, leukemia, any eating disorders like anorexia, or the actual disease, osteogenesis, it's a brittle bone disease, or kidney disease and celiac disease. These will all lead up to why this person has osteoporosis at such a young age. And, the second type is called idiopathic osteoporosis. And this type, it occurs with no reason whatsoever. Why should this person have osteoporosis? They're a normal, healthy being. They have really good calcium levels and vitamin D levels, and it's rarely seen, and it only happens in 0.4 cases per 100,000 people, so it's a very rare condition. And however, I was doing a little bit of research, and it was saying that this disease maybe caused pregnancy problems, but that's just very rare still, and we just don't know why it happens. But back to normal osteoporosis, demographics, who gets it, roughly about 75 million people worldwide. But if you look at the ethnic groups and race further down, white women are more affected than men, than any other, from both genders and all ethnic groups. And like I said, women, they're more prone to it, so they experience faster bone loss density in their 50s rather than men do. But if you look at 10 years down the road at age 60, they both kind of level off, and they lose bone at the same amount of rate. And what leads to it is because the higher risk in women rises sharply after they begin menopause. So I have another picture for you guys. So you can see different stages of osteoporosis. So that's age 40, it's normal. Then at age 50, you see the bones start to get those wider gaps, and then at age 70-ish is when you see them start hunching over. But some of you may ask why are women more at risk besides the menopausal rate? So if you look at teens and college-age women who exercise and are stuff like that, they're at a higher risk because of their menstrual cycles are off track and everything, which leads to the condition called amenorrhea, which is the loss of the cycles, and that's linked to lower estrogen levels, and the lower estrogen levels is what may cause the osteoporosis to occur in more women. And so to fight the lower estrogen levels, you can you are able to gain weight if you're underweight, or if you're overweight you can lose weight. So you need to get a good healthy body weight. That'll be good. Or you can ask your doctor about medication, like just birth control to sort it out. Or you can eat soy products, because if you look at the soy chemical in it, it's isoflavones, whatever. It's just it's a chemical in the soy product that will help boost off your estrogen levels. Or you can look at vitamin supplements like vitamin D, calcium to help with that. But what may trigger or lead to osteoporosis, there are a couple different factors, like nutritional factors. Like if you have a diet that consists of like high caffeine, sugar, fat, alcohol, or salt, that can lead up to osteoporosis, as well as processed foods, or if you eat like food on the run, if you're like late to work or whatever and you're on the run a lot, or if you skip meals altogether, or if you don't eat enough of like the right nutrients. Of course, that's not healthy for your body. So in a way, the nutritional factors just leads from incomplete nutrition for your body. So, and then on the opposite side, there's lifestyle factors. Like sometimes people just have poor muscle development. There's nothing they can do about that. And there's obviously if you don't work out enough, or if you don't exercise enough, you don't have enough physical activity going on, that's gonna lead to bigger problems. Or if you use drugs, it just offsets your body completely. Or certain medications. When I was doing research, like it said that like some of like psychological disorders, like that medication will kind of leach off from other nutrients that your body's getting, that can lead to healthier bones. It just kind of throws it off a little bit, as well as stress that can also throw your body off, as well as some other medical conditions. But some of the unchangeable risk factors, there are, like I said, sex. You can't control what your sex is when you're born. There's age. You can't control that. Everyone ages, obviously. Your race, like I said earlier, white women are more like susceptible to osteoporosis than any other ethnic group or gender. But if you look at your family history as well, if if your grandparents have it, you're more likely to get it. Like my grandma has it, so I have a higher chance. But since I'm a male, it's probably not going to be as high as a white female would. But also, if you look at your body frame or size, like smaller people will they're able to be more susceptible to osteoporosis because like they're tinier frame. And so to actually treat osteoporosis, there's no cure, but there's only just the measures in order to prevent it. So like I said, it includes like a variety of like lifestyle changes and like kicking those old bad habits, like correcting your posture, sitting up straight, and only medication for like preventing like further bone loss. So you can just take other stuff to like just boost what your body needs right now. But however, I was doing research and there are some advancements in medicine that they've been doing. There's this one drug that's been approved by the FDA, and it's called Prolia. And I'll talk about it in a minute. But there are also some other like lifestyle things you can do, like to treat the risk factors. There you can increase your exercise, because just like muscles, bones will get stronger like when used. So like any like weight bearing exercises, like walking, dancing, or like running or anything like that, or lifting weights. Those are like the best moves to increase the bone density and make your bones a lot stronger. And there's also, you can change your diet for strong bones. Like I said earlier, you need calcium and vitamin D. And so like some like high calcium foods are like dairy products like milk, cheese, stuff like that. Green vegetables have a high calcium intake, as well as like sardines and like salmon and fish. But you have to keep the bones in them, so there's the protein in that. There's also that tofu, like I said earlier, like soy products will help boost those estrogen levels. And then also there's some like vitamin D food, like fish and fish oil, beef liver, egg yolks, and like some breakfast cereals. You can do that. And also, like, even if you spend time in the sun, like your body needs vitamin D, absolutely. So even if you spend just a couple minutes out in the sun, that'll be good for your skin, because your skin takes it in and about it. But don't be careful not to spend too much time in the sun because then it'll lead to cancer, obviously. Like I said a second ago, there was this drug called Prolia, and what it is, it's an antibody that's designed to treat osteoporosis in postmenopausal women, which will increase bone mass. And it's commonly used in patients who are undergoing like cancer treatment, because as you may see, like the results of someone being on a cancer treatment, they're going to be their body's offset pretty much. And here's the drug. Pretty much, it's just like a shot that doctors give the patients 2 times a year, and it's like you can inject it on your like chest or your back. But I did read an article about it, and it just pretty much went over like a brief overview of the drug and like some of the nasty side effects, and like when taking the drug, and it's just nasty side effects. Like I wouldn't even go through it. But here is this video I was going to show you guys. It's about Oprah and another doctor, and he shows her like what osteoporotic bone looks like versus a regular bone.
You have less than 10%. You think it's enough?
Okay, that's fine.
Let's take a look at osteoporosis. Let's get dirty here. Get dirty! So let's just take a bone that we often look at. This is what the spine looks like. Wow. And that's actually what a ridge that is in the meniscus of the spine. And in the middle, of course, is the pulse. Now, let me just take the spine and cut it in half and show you 2 people who have spines that are very different. This is a spine that I've cut. Feel that. Okay? Oh, please.
I'm just taking it easy.
You can squeeze it, right?
Wow, it's like a rib.
Like a rib.
Yeah.
Now,
When you're eating, yeah, rib.
that's a normal spine. Like a normal rib.
Yeah.
What you'd expect to see
Well, that's a spine
in a restaurant
from a person.
for a person.
Okay.
Now, this
Ooh, no.
is the osteoporotic bone.
Oh.
Now, I want you to take this. I want everyone to see this. I want you to take it, and I want you to break it.
To break this?
Break it.
Okay. Ooh.
Doesn't take much.
Wow.
Doesn't take much. This is what happens in osteoporosis. When we talk about getting frail, these little bone pieces here that make up the spinal column will collapse, giving you a hump, the dowager's hump.
Yeah.
That's why people get shorter and shorter and shorter as they move, and then they can't get the kind of fullness in life, and that's why you don't want to look like that. But it doesn't have to be, because this bone is from someone who's older than this one is from.
That's about it, pretty much. So then, yeah, like I said, you just went over like what a normal bone looks like versus an osteoporotic bone. And then here are my citations. That's about it. You guys have any questions?
No, I'm done.
Thank you.
It's gonna stop or it's gonna...
You have to press the button.